Let's look at the documents that they put out yesterday. Here's the slideshow. So New York City employees PPO plan, the proposed healthcare plan for in-service and pre-Medicare retirees. What I want to say to you in starting this review, we cannot tell you whether this is a good plan or a bad plan if we don't see the contract. And no one has seen the contract yet. Not the unions, not the unions, the MLC, not the small healthcare committee from the United Federation of Teachers that supposedly said it was a good plan and passed it to the DA to vote on. No one has seen the contract. And you know from us, from this very beginning of this fight, one of the reasons why the judge gave an injunction to stop them from city from forcing you into this plan was because you could not tell whether or not your doctors, your hospitals were in the plan, what the prior authorizations were, none of that. And right now, unfortunately, that's exactly what this little steering committee said was, this is a great plan, let's send it to the DA. But they don't have this information. So I want to start showing you the slide presentation that they distributed. Who distributed this? This was distributed by the MLC to all of the MLC member unions. Now, that's another issue that I have with this, and I think I would rather this forum be one of those where we're actually talking about what questions should union members ask their unions, their delegates, their chapter leaders, their whatever, because this is if this plan passes and you don't have all of this information and it later becomes a problem, then their committee is going to have to figure out how the hell to fix it. So in starting looking at this, it says, why now? And it says members have been reported concerns about the city's GHI CBP plan, which of course we've been doing for decades. Hard to find in-network doctors, especially out of state. Difficulty finding behavioral mental health providers. Even in the 5 boroughs, that's been an issue. We have fought constantly to prevent copay increases. I'll say that's subjective. Healthcare costs have nearly doubled since 2015, going from $16,000 to $31,000 for a family plan. And I'll say that's premium. And I think the 31,000 is a little high. I believe before it was like 27, but it was still in that same ballpark, putting premium-free coverage at risk. The intent of the negotiated acquisition was to preserve premium-free healthcare while addressing these issues with the current plan. Now, you've heard me say a million times that a lot of the union leadership will like to say, but it's premium-free, quality healthcare. But when they're nickel and diming you to death in copays and deductibles like they are for Medicare-eligible people, that's criminal. And that is still what we're seeing. So let's start page 2. What is a negotiated acquisition? Every year, the premium-free healthcare is negotiated through the MLC, but for the past 40 years, those negotiations have taken place with the same providers, Emblem and Anthem. 3 years ago, the city and the MLC jointly decided to explore alternative options for the CBP plan, and this was done through a process called negotiated acquisition, which tells all interested parties what we're looking for, something better than what we have, and we want these improvements, so give us your best offer. And it allows them to go back and forth too, because if they don't like something, they'll say, okay, let's fix that. They'll go back and forth. And then finally, they'll do like a best and final where they tweak everything and then that's it. So the negotiated acquisition process presented an opportunity to keep our current network of doctors and adding more, maintaining and expanding our benefits, expanding access to mental health, protecting us from rising copays, and locking in premium-free coverage for 5 years, a significant shift from our typical year-to-year contracts. Now, the questions that we have on this and health policy experts that we work with is we haven't seen what the protection is from rising copays. What is the protection? How long are they locked in at this rate? Or when will they be eligible to go up? Is it locked in for the full 5 years? Also, we're not seeing where there's an expanded network other than the national network. And also, we have questions about the network. Who's in it? Who's in the medical network? Who's in the hospital network, both nationally as well as locally? And we'll get to that next. We also, if I want to interject one more point that we had, was They also will talk about doctors in the network and whether or not they're accepting new patients. And I'll bring that up in another slide. So here was the timeline of when they did things. The MLC unions. So what happens next? The MLC unions will have MLC member unions will have an opportunity to review the proposed plan in advance. This bothers me because, and as well as our policy experts, because this healthcare plan affects every New York City employee and their family. And they're only giving a union representative one day from an MLC member union. So if you're not a union, as a member of the MLC, I don't know, was it Tough Noogies? I really can't tell you, but I don't like that. This should be open to everyone, not just the union leadership, but it should be open to the boards, and the board should be able to bring all of this information back to their union members, and the members should have full transparency. Transparency. You remember that word? Transparency. That's one of the things that the unions are always fighting for with the Civil Service and Labor Chair, Julie Menin. You always hear Michael Mulgrew and the UFT talking about that in DC 37 is hospital transparency, medical transparency. Well, this would be transparency. Who's in the damn network? Union representatives who wish to examine the proposed agreement will be able to do so in person at DC 37's offices. Member unions will also receive a briefing from Siegel and have time to review and consider matters before any vote. I will tell you, if I was a union leader today, I wouldn't believe what anyone is telling me by word of mouth because they've all been lied to before. Right? And how many times? Remember, every doctor will take this Medicare Advantage plan. It's better. It's got perks. You'll like it. So what I want to urge anyone who's active union, anyone who has connections to a union leader, anyone who has any friends that's a delegate or whatever, you should be asking these questions because this is important. Why am I only being given one day and one person from my union and the availability to see a contract in person at DC 37 headquarters? And I can't even bring it back to review it with my members. Siegel, that's a great question, Marcia. Thanks for asking that. Siegel is the consultant that the MLC has. Siegel Consulting. And you'll also, back in some of the MA plans, you'll see that the city and the MLC have flip-flopped some of their consultants. The city uses Milliman. The MLC sometimes uses Milliman. The MLC uses Siegel Consulting. Sometimes the city uses Siegel. It's very incestuous to me. I think it's very bad, but that's a whole nother video in itself. What I don't get is, doesn't this hurt the folks making these decisions too? What am I missing? Karen, what I think is there's a deal attached to this somewhere. And that's why I can't say if the plan is a good plan or a bad plan, because I haven't seen the contract. No one has seen the contract. So that in itself is problematic because there is no way that UFT Healthcare Committee could have said that this is a great plan just on the say-so of Michael Mulgrew without seeing the contract, because as we all know, the devil is in the details. So this I have a problem with, that it's limited to one day, to one representative from the union, and only member unions of the MLC can see this. Everyone should be able to see this. You don't buy a house, you don't buy a car without looking at the contract. Sorry, guys, I don't agree with that part. So that should be another question. Why is this limited? And don't give me this hokey excuse of proprietary whatever. There should be nothing proprietary. Taxpayer dollars pay for this. Taxpayer dollars pay for this. This should be fully transparent. They argued for transparency. They argued that they wanted transparency in the health program, in the hospital plans, in the billing for them, for all of the treatment codes. They wanted transparency. This would be transparency. Why don't you have that? So that would be my question. It says the MLC Steering Committee will then consider the proposed agreement at the next general membership meeting. The MLC will vote on the proposed plan, and a ratification vote is anticipated by the end of September. Now, I have a problem with that too. This is a rushed procedure, just like they did for Medicare Advantage. This does not give people enough time to look at this contract. Today, someone said, oh, well, Michael Mulgrew said the contract's only 150 pages. I call bullshit on that. The Aetna Medicare Advantage contract was over 10,800 pages. There is no way in hell this contract is 150 pages. That tells me they're not seeing the formulary of all the medications in the plan. They're not seeing all the prior authorizations, and they're not seeing the network of providers at a minimum. And they're not seeing who's in the network. And remember again, the judge in our cases stopped our plans from being implemented because participants, the city workers and the members, the retirees that were going to push into these plans would not have known whether or not this plan benefited them. And remember this, your open enrollment starts in November? You have to have this information before you could make a decision. And if you're not going to know this, that's arbitrary and capricious. I will guarantee you any judge will give a preliminary injunction in stopping this unless the people have an opportunity to see this. So if active workers are listening to me, demand to see the contract and not this redacted shit either. Okay, so that is the plan. I must have missed something. Hold on. Am I missing something? Oh, here we go. Why Emblem United? Keeping our current doctors. There should be virtually no disruption in care. Virtually, I don't like that word either. Virtually. There's virtually no disruption. Only 5,000 people aren't going to have access to doctors. I want to know, what is the disruption analysis that was done? Let's share that. What do you say is virtually no? Because again, remember what they said to Medicare retirees. Every doctor that accepts Medicare accepts this plan. We know that wasn't true. There was a question I just wanted to. Can any legal action be taken regarding the union negotiating benefits for retirees for whom they don't legally represent? So, Mike, I'll bring that to Jake and Steve. That is a good question, because unions do not represent retirees. And actually, some of you guys have been messaging us, telling us that DC 37 has been sending solicitations to you to join the DC 37 Retirees Association. And on there is a clause that by signing and joining, that you allow DC 37 to be your legal representative or some crap like that. Unions cannot represent retirees. Hard stop. They cannot represent retirees. Maybe be a retiree association representative, but you should better read the small print that if you want to trust the very people that have been jamming this down your throat for the last 4.5 years and do that, well, that's on you. But I'm choosing our group because I'll tell you, we're the only ones literally fighting for you. Who is the head of the MLC? That's a really good question, Karen. There was an election, and it was between Henry Garrido and Greg Floyd, and they could not get a majority. Right now, there is no head. Chris, in this day and age with transparency, this is total bullshit. I agree with you. Marie Para, we pay union dues. That should be enough to show us the contract. Marie? I agree with you. That is your mandatory subject of bargaining, my friend. So it says, keeping our doctors, there'd be virtually no disruption in care, as our members would be able to keep the same in-network doctors. Remember, key right there is in-network. So if you've been seeing any doctor that's not in-network or in the network, whatever their network is, that you're going to need to know this. This is why it's important that they be providing you with links to the doctors, the hospitals. You need to know who's in the network, where's the tiering, and I'll show you that next. Expanded network rater access. Emblem Health, United Health would significantly expand our network of doctors, hospitals, and other services, which is especially beneficial to pre-Medicare retirees outside the downstate New York 13 area. And I'm going to show you what that area is, because I think they mentioned that either in the next slide. Premium-free healthcare is for 5 years. There was a clear roadmap that enabled us to keep premium-free healthcare coverage. That, to me, is another trigger point statement for me, because they also said the same crap about the Medicare Advantage. So I'm not really comfortable, with that. Okay. Why Emblem vastly improved access to behavioral mental health, willingness to negotiate and reduce the number of prior authorizations, and a commitment to maintaining copay-free care for ACPNYs, which is your Advantage Care Physician Network, MSK, and HSS. Okay. I find this second bullet point somewhat of a joke because they literally negotiated prior authorizations. The unions do that in the MLC. The MLC negotiates your copays, your deductibles, your prior authorizations, and your network. So I don't understand the willingness. They're the ones that actually impose them. Okay. Overview of the proposed plan benefits. If approved, the New York City NYCE, I'm assuming New York City Employee PPO, would replace the current GHI CDP plan for in-service New York City workers and pre-Medicare retirees starting January 1st. That's another concern that we have is implementation by that date. Would you have enough information given to you to be able to make a decision? All the benefits and services that we have in our current plan will be offered in the New York City ePPO, plus additional features and enhancements. So that's another concern for us. Right now, based on this, what we're seeing, I would demand to see the contract. There's no decision can be made if I'm not seeing the contract. We need to know the details. Otherwise, how can the unions being asked to vote on this plan, and the controller, of course, because this is going to have to go back to Brand Lander, who will review this agreement, make decisions about what's best for city workers and their families. You can't. And so I can't tell you if everything is in the network. The benefits that they're described in this plan, that of the documents that they've made public, the benefits like doctors, labs, x-rays, etc., all of that seems to be the same. The two questions about the differences, though, is not. They're not revealing that. That's not transparent. And that is what hospitals are in Emblem's network. And I'm going to explain that in a minute. What hospitals are in Emblem's network and what plan management, meaning what plan limitations for the network, some procedures, prior authorization requirements, denials, where's all that spelled out in the contract? And so I can't tell you whether or not this is better or not, because they're not sharing with you a critical piece of the evidence to be able to make that decision. And that's where I can tell you for a fact, they cannot say that this plan mirrors, like they used to say with Medicare Advantage, mirrors what they were giving you or make it better. And until we see that, we can't tell you that it is. Now, New York State's downstate 13 counties right here, okay? It says Emblem Health would provide coverage for doctors and hospitals in New York City and the rest of the downstate 13 counties, which includes Long Island, Hudson Valley, Dutchess, Orange, Putnam, Rockland, Ulster, and Westchester. So what does that mean? That means that if you are in one of those 13 counties, Emblem Health is not just your medical, it's also your hospital. And remember, your hospital used to be Anthem until they kicked them to the curb, okay? So Emblem doesn't have hospitals. What hospitals are in Emblem's network? We want to know that. That's a really important question, because in some of these situations, if depending if your hospital is in the network or out of the network, and I'm going to talk to you when I show you the chart, you could be paying a fortune if your hospital's not in the network. And that's really important. And that's downstate 13 counties. Outside of those 13 counties, United Healthcare would provide the national coverage for doctors and hospitals outside of Emblem's coverage area, okay? United Healthcare would provide the behavioral and mental health in New York and nationally. And that should be a larger network. So your retirees from Florida to California to Iowa should hopefully have providers within their network. I also want to know where they don't have coverage, because a retiree today told me that there's supposedly no coverage in Alaska and Montana, and we have retirees in both states. Just saying. One network. So Emblem Healthcare will now provide both medical and hospital coverage, and United Healthcare will provide both medical and hospital. As a result, members would receive a single ID card, replacing the current system of 2 ID cards. I find that as a joke because like that one card isn't like weighing my pocket down. It's like, who really gives a damn that you got 2 cards, but whatever. There would be 1 website and 1 member portal. Right now you do have 2. 1 in-network out-of-pocket maximum, which will remain at a total of $7,150 for individuals and $14,300 for families. That is also a concern. If you're out of network, just know, because if the hospital that's nearest to you is not in the network, you could be paying a lot of money for care. Okay, improved benefits in the proposed plan, an expanded network, more doctors locally and nationwide, 78,000 providers in the downstate 13, up from 64,000 in the current GHI plan, not to drop below 74,000, 97% of which have availability to see new patients. So now I'd really like to see those statistics. I want to see the evidence of that. Also, because in the next point where they'll talk about how many doctors are added to the plan or included the plan. This expanded national network is especially beneficial for pre-Medicare retirees who live outside the downstate 13 counties and traveling in-service members. 1.6 million providers outside the downstate 13, up from 29,000 in the current GHI CVP plan. Well, that's a ridiculous comment because Aetna also made the same comments, like 1.4 million providers nationwide, but there aren't 1.6 million providers in the nation. And if you look at like the AMA's reports, it'll tell you exactly how many providers are in America, and it's not 1.6. What they're doing here is, remember, you always have to ask an insurance company how many belly buttons, meaning how many individual doctors are in the network, because what they'll do is they'll count some doctors as 2 or 3. So let's say you're a gynecologist and you're an internist, and they will count that you're one person. And like, so you have 2 specialties. They will count you as 2 doctors. And if you have 2 offices, you're now 4 doctors. That's not real. So keep that in mind if you're struggling to find doctors and this plan gets implemented, that has to be a complaint right away. In the top 16 states where city retirees and members reside, there would now be more than 500,000 in-network doctors. I would like them to list, for full transparency, what are those top 16 states? And if they would also do it completely by state, that would be even more transparent. Improved benefits in the proposed plan continued. NYCE PPO must maintain a robust network of providers. At least 90% of all services in the downstate 13 would have to be in network. Well, I'm concerned about that too. Downstate, at least 90% of all services. Well, that means 10% of services are going to be out of network. Why? At least 95% of all services outside downstate 13 would have to be in network. Emblem Health, United Healthcare, would commit to bringing highly utilized out-of-network providers into the network. I'm concerned that that's not already done. If there are other networks, that there are other doctors that are not in the network, why haven't they done that already? They obviously know who they are. Doctors are probably, retirees are probably retirees are seeing doctors. How do they not know where they're going? They're probably using their Anthem card or their Emblem card, and maybe those bills are getting denied. So they do know where these people are going. That to me would be a concern. Maybe new doctors, but I'd still like to know what is the utilization right now in the downstate or the downstate 13, outside the downstate 13 area that would be considered out of network. That's a high number, that at least 90% of all services in the downstate 13 would have to be in network. That still leaves a 10% variable. Behavioral mental health would now be provided by United. New York State, the increase from 12,000 providers to 39,000, not to drop below 39,000. That's huge, because I know many complaints that we've seen from employees and retirees in finding mental health providers was criminal that they could not secure a provider. nationally increased from 61,000 to 418,000. At least 86% of behavioral mental health must be in network. The New York City PPO will offer 22 specialty virtual behavioral mental health carriers, up from the 7 that are offered today under the GHI plan. These can be accessed through your Emblem Health concierge services under the NYCE PPO. Examples include Charlie Health, Hazelden Betty Ford, InStride Health, and Talkspace. Prior authorizations. This is another concern that we have. Prior auths would decrease by 50%. Well, if they're not telling you how many they had, 50% could still be high. There shouldn't be prior authorizations in healthcare. I know Mulgrew used to always say that, he actually uses the Elon Musk science. It's for waste, fraud, and abuse. It's criminal that would be there, but I want to know how many there are. I want to know what they are. And I want them also by name and CPT code. That's the way they should give them to you. And that tells me that you guys also haven't seen that, the people that have been making these decisions on this plan either. We want to know what those are. He says that if this change had been in place in the GHI plan last year, 461,911 claims would not have required prior auth. Well, you're also not telling me how many there were. So I really can't base that. You're talking about almost 1 million people on this plan. What were the total? And don't say would decrease by 50%. We know their rounding math, their new math is really sucky. So I think they need to, full transparency, we need to have more details. Let me just take a quick look in the chat. Where have we heard that before? We must sign it before we can see what's in it. Mulgrew loves to rush. It's the MO he uses to ram something unacceptable through. I completely agree with you. I am not happy with what happened yesterday. According to Michael Mulgrew, this plan is not diminished. And Marie, I can't tell you if it is if I don't see the contract. I need the contract to prove the details. There's a lot of things that are in those contracts. And look, if we had that contract up front on the MA plan, we probably wouldn't have had to been fighting this for 4 years. Let's keep it real. Adams deferred on shoving Medicare disadvantage down our throat. This BS proposal PPO plan is the reason why. I'm not really sure on that, but like I said, I really do want to ask questions. The questions have to be asked by everybody, retirees, employees. This really needs to happen. You cannot make a decision without seeing the contract. You guys don't buy houses and cars and other shit without seeing the full contract. You need to see the contract. Okay, let's see. So prior auths in the current plan that were removed include some of the most frequently used services like MRIs, CAT scans, orthopedic surgeries, office-based dermatology, pain injections, home visits, etc. To ensure procedures and services are medically necessary and safe, some prior authorizations were added for emerging technology in the medical industry for highly complex surgeries and implants, heart transplants, brain surgery, and high cost equipment. So, and that's also somewhat consistent with what's in traditional Medicare. There's rare prior authorization in traditional Medicare. There's not rare prior authorization here. And so that, to me, would be a concern. I can understand where you might want to put a prior authorization on specific providers who are known to abuse the system or abuse specific types of treatment modalities. That's not being done here. These are blanket prior auths, and that's one of the things many of us disagree with. The review committee, a review committee made up of members from Emblem Health, United Health, the city, and the MLC. I don't see retiree group. Do you see my name in there? Like Marianne, New York City Retirees? I don't see that in there either. Who's representing retirees in this issue? Nobody. And that's because they don't give retirees a voice. And yet, this is another situation of which they want to try to impose something on them without knowing your needs. They all think they have their consultants and their attorneys and they know what they're talking about, but they don't live our life and they don't walk in our shoes. Would meet monthly to review reports on plan implementation and data trends on issues, including recurring costs, including costs, prior authorization, and claim denials. Expedited process of any issues that arise, mediation, binding arbitration. Well, who's going to be taking the calls from retirees? Because right now the unions don't want to take calls from retirees either. So that ends up leaving us with, screaming at OLR, who doesn't answer us on many of these issues either. We have a handful of complaints right now into OLR on how they're mishandling copays, and they're just ignoring us. You call some of your unions, they're ignoring you too. So this is not the way to deal with this. This procedure needs to be improved. Care management support, expanded diabetes management, hypertension, home health visits, oncology, cardiac rehab, chronic pain management, high-risk asthma, women's health, maternity and menopause, personalized health assessments, health coaching, health education. I'm going to tell you, many of this is described as health management. Literally health management. So they're going to want to see, and this is another thing that we saw in the Medicare Advantage plan. If you were going to the doctor and some of your care exceeds a certain dollar amount, then they start to manage you more. We don't see that. There's no answer to that here. What are they doing to care management support? They make it sound like, oh, we're the good hands people and we're going to hold you and cuddle you and take care of you. But literally they could be minimizing your health care, and we're not going to know that if we don't see the contract. So I want to see what's in the details, dude. Show it to me. And yes, you could be stuck in this plan. If you're retiring, like some of our uniform people do, great point. Some of the uniform people can retire early. You're kind of stuck in this plan if it's not a good plan. Sometimes you're 23 years away from Medicare, 20 years away from Medicare. This is the plan you're in. So, and that's saying that we still are able to afford Medicare traditional with all the damn copays that they're all keep, sticking on us that are costing many of you a car payment. So that's just, to me, is even more frustrating. I go to MSK and I have to pay copays each time I go. So Ellie, I don't know if you're non-Medicare or Medicare, but on Medicare, you would be paying. In this plan, it appears you might not. And let me get to that chart next, and then we'll go over that. But again, different plan if you're Medicare eligible. Janet Paul, I live in New Jersey, and that was true for me too before I retired. For pre-Medicare eligible retirees, this is likely going to be the same shit that we experienced with Aetna's MAP and geographical lack of coverage. And so, Ellen, I really can't say that to you because they're not giving me the network. I can't tell you that. Like when we saw Aetna's contract, it literally gave us all of the states and all of the counties in those states in which they had coverage. In this plan, I don't have a contract. I don't see their network, and I don't see the states and the counties in which they have coverage. And in the contract for Aetna Medicare Advantage, what they did was they said that they only had to cover 51% of the members in the network. Is that provision in here too? I can't tell you that. I don't know because I don't have the contract. So good question. Do we know whether the copays will be the same as the current? So Mike, give me a few minutes. I'm almost done with this and I'll move on to the next thing. That's why I booked this for 2 hours. Okay. I'm not leaving you, and I'll go through it. And ironically, all of these documents are up on the UFT website. None of the other unions knew to put them up on their website, or they were supposedly were told not to, and the UFT did. But we will also email them out to everyone. So if you're not on our email list, you better get on it. And make a donation to us too while you're there, because I think this is going to be a long fight. A critical detail about the proposed New York City PPO is who controls claims and utilization. Inside New York State, Emblem Health is responsible for approvals, authorizations, and denials. So, Katie, that is a really great point. Right now, the plan that you guys have, the GHI CBP plan, everything in that plan has to go through the State of New York DFS, Department of Financial Services, the insurance department. This plan literally puts it in the hands of the city. And of course, the city and the MLC. So there is no oversight. Whatever the city does, the city does. It changes the construct and the oversight of the plan. It moves it from the state insurance department to the city. That's a whole nother conversation, but also good point. And thank you for bringing that up. Is there a plan to initiate an injunction on this proposed new plan? Beth, great question too. Well, there's nothing for us to injunct if I don't see the contract. I need to see that contract. Right now, what you have is not enough for anyone to make a decision. And remember, in our cases, the judge, based on shit like this, stopped these plans from being implemented. So if the city of New York is listening and some really wise union leaders, you're not going to want to make the same decision, the same mistake twice. You're going to want to make a better decision, be more transparent, and put this information out there because that's the right thing to do. So this is like Mission Impossible episode where someone has to go and take pictures of the contract. Chris, and that's if you're allowed to bring your phone in, because in some of these meetings, they wouldn't allow you to leave when they did one of these events in DC 37, they locked up all their phones. They could not bring their phones into the meeting room. So I can't tell you. No, Ellen, this is not only for UFT. This is for every New York City retiree and every active worker. This replaces the GHI CBP plan. Okay, so care management, we talked about wellness support. We talked about personalized health assessments, coaching, health education. So there might be some good stuff in there, like in the wellness area, but still this is screaming to me, like read between the lines. This is about care management and how they can reduce what you're spending and control what care you're getting. This, while they say it's a PPO, I'm going to show you on the next chart that we'll look at. It's really looking like a managed care plan, a managed PPO, like an HMO within a PPO. And I'll show you what I'm talking about when I get there. Okay. $0 copays, expanded preferred provider network. This is the network that I'm talking to you about. Expanded preferred provider network, New York City Health and Hospitals joins the Advantage Care Physicians, ACPNY, as preferred providers with copays of $0 for primary care visits, specialty visits, physical therapy, x-rays, labs, inpatient facilities, and chiropractor. Now, what bothers me about this is they're willing to do this to knock down copays to $0 if you use a specific network of doctors. In Medicare, we don't have networks. And yet they jacked up our copays from $50 to $60, from 15 up to multiples of 15 up to like $60 every time we go to the doctor. If we have PT 3 times a week and then the doctor wants us to do an x-ray, you're paying 15, 15, 15, and another 15 for an x-ray. And then if the doctor has to review that x-ray, that's another 15 for the guy that read it. And if your doctor is in a hospital, that's another 15 for facility fee. They waived that for active workers who in many cases make 3, 4, 5 times what we make, and they didn't reduce that or pause that or they didn't work with us Medicare retirees on making them any more affordable. There are no networks in Medicare. That's the beauty of Medicare. So I don't understand why they did that. Literally, again, it's almost like we're funding their $0 copays. New York City PICA prescription drug program. Remember, PICA is only for active workers and non-Medicare retirees, not for Medicare eligible people. It will be administered by Express Scripts. It's Express Scripts, and it's not changing at this time. Many in-service members receive their prescription benefits through their union welfare fund. These programs will not be affected. In-service members who receive their prescription benefit by purchasing the optional rider would be covered under the New York City EPPO plan through the city's pharmacy benefit manager, Prime Therapeutics. Now, there's been a lot of people messaging us about Prime Therapeutics, where there's a lot of issues with this company. There continue to be there will continue to be a mail order service available. In-service members who receive other prescription drugs through their city health plan, including Affordable Care Act and the New York State mandated drug for such diabetes medication, birth control, would still receive their drugs under the NYCE PPO. Pre-Medicare retirees who receive their prescription benefit through the Union Welfare Fund or by purchasing the optional rider, but still with the optional riders, or actually through the NYCE PPO plan, pharmacy benefit manager, there is no contract. So there is no Prime Therapeutic formulary. I don't know what the formulary is, and we'll get to that in a second because they actually talk a little bit about it. Prescriptions for ACA New York State mandated drugs and for pre-Medicare retirees. Expansion of drugs covered by New York City EPPO. 20,000, 40% more medications are in the formulary list of approved medications, as Prime Therapeutics would replace Express Scripts as the pharmacy benefit manager of the PBM. But they're not giving you the formulary. When we had the Medicare Advantage plan, they gave us the formulary. I don't see that here. 98% of prescriptions currently filled by pre-Medicare retirees in the GHI plan would still be covered, only 2% having to change to an alternative medication. That bothers me as well, because depending upon how many people that covers, 2% is a lot. And to make them change to an alternative medication, let's say that medication, like a rheumatological medication, is working for them. Why would you put that patient through pain and discomfort just to change their medication if they're already on a drug that works? That to me is not healthcare. There needs to be an appeal process for that. Many doctors will not want their patients to suffer experiencing pain for multiple months to try to find something that you think is cheaper when they already are on a drug after multiple trials of medications that they found something that worked. Then it says 98% of prescriptions, 99% of prescriptions currently mandated by the Affordable Care Act and the New York State diabetes drugs would still be covered, with only 1% to change to an alternative medication. I like how they say only 1%. So, I mean, you have 750,000 people on this plan. 1% is still a lot of people that are changing medications. Prime Therapeutics would allow for a customized formulary and a way to tweak it as needed. There's no explanation to that. That needs to be more transparent. And it says, which can't be done under the current plan without impacting the cost. Prime Therapeutics does not own a retail or mail order pharmacy, meaning it can shop around for the best prices. Why can't I see what that last? Oh, there it goes. Rather than directing businesses to its own inventory. And that should theoretically help keep prices down, but still, I'd like to see the contract and I'd like to see the formulary. Okay, so that looks like the end of that one. Now let's look at a couple of questions and then I'll move into the next document. Karen, then what happens after 5 years? So many questions. Before voting, they should all be answered. Imagine folks knew about this. It's Labor Day weekend. That's another issue that I have with this. I bet people don't even know, how do you get the word out? When's the vote? Does each union vote on a different day? Sorry, so many questions. Just trying to understand this. So Karen, like we said before, this would, and actually, let me go back to what they said, because you might have missed that in the beginning. It does say that unions will have the ability to examine this, and we know we were told that they only have 1 day to see it in person. Member unions will receive a briefing from Siegel. Again, I don't like that. Member unions. Every New York City union should be part of this. It is a New York City healthcare plan. MLC steering committee will then consider the proposed agreement, and at the next general membership meeting, the MLC will vote on the proposed plan, and a ratification is anticipated for the end of September. That literally means in 1 month from now, this plan will probably be ramrod through, because they're not giving anyone time to look at this. And I know contracts are not 150 pages. There is no way in hell this contract is 150 pages. So I don't understand that. That's really it's just really disingenuous of them to say. So, let's see. United Healthcare is a terrible MH network. It's all ghost networks. I would hope to God it's not. How did Marianne get this info? I can't find it anywhere. Also, where is the info for in-service? That's a secret too. So Susan Conlon, if you are UFT, your union, literally put this, your former union or union, I don't know if you're active or retired. This is literally on the UFT website. But I said to you, please make sure you are on our email list, because I will email these both out today and you can both review them. We were told that these were not to be distributed. And we always try to, honor what we're told about when we're given documents, especially when we receive them, the way we do. So when we saw that these documents that these other unions were told to keep secret was literally public on the United Federation of Teachers website, we were like, what the hell is so secret about them? And why can they publish them, but all of you can't? Also, I want to remind you of something. This is the same crap that they put out when they were trying to jam through the Medicare Advantage plan. They want you to see something specific. They're not saying to you, hey, these are the pros. But hey, I just want you to know, full transparency. There are some little issues, but the good weighs out the bad. Maybe that's the case. But you should be able to say that. And they're not letting you see that. Okay. That's a problem, because you should be able to have that knowledge to make a decision on whether or not this plan is for you. So, Janet, are they trying to phase out GHI and eventually GHI senior care? I'm telling you right now, Mulgrew wrote an email to people, and let me see if I can pull that up quickly. A retiree wrote to Michael Mulgrew, and let me just clear my screen 1 second. So, and so I'll show you that this is the email that Mulgrew wrote. Dear Judith, I just want to write to you to make it clear that GHI Senior Care Plan remains in effect with no changes. The city and the MLC committee have reached a tentative agreement on a new city health plan, which, if approved, would replace the GHI CBP for in-service city workers and pre-Medicare retirees only. The plan proposed has no effect on GHI Senior Care or any other city health plan for Medicare-eligible retirees. If you have dependents who are not eligible for Medicare and are currently enrolled in the GHI CBP plan, they would automatically be enrolled in the new plan on January 1 of 2026, if it is approved. If you have been hearing about the proposed plan, it is likely because it would be particularly beneficial for our pre-Medicare retirees, because it would increase the national network by providers by 1.6 million. I love number fudging. I've also heard questions resurfacing about the possibility of a new Medicare Advantage plan for city retirees. Let me be clear. There is no potential Medicare Advantage plan. The United Federation of Teachers stands firmly against Medicare Advantage plans for our retirees, as we affirmed in a resolution, which is the highest decision-making body of our union. And it's signed Michael Mulgrew. That's all I could tell you at this point. But he's saying that is not true. Okay. If this plan is so great, why the secrecy? Hey, Camille, I got the same question. I know. What can I tell you? Great minds think alike. It would be helpful to view the current plan and the proposed plan side by side. So, Letitia, that's what this is for. And let me see. I need to see exactly how you see that. Give me 1 second. Because I want to see how that comes across. So if I need to adjust my screen. And again, it's not what they're showing you or telling you. It's what they're not telling you that I don't like. Because that's what they did in the other plan. You know, it basically causes a level of distrust, you know? I don't like that. Give me 1 second. Well, for whatever reason, that's not coming through. Are you guys able to see my screen? I'm going to just jump down and see if you're answering me. Are you able to see that clear, or do you need me to? Let me see if I can make it bigger. You don't need to see me. You need to see the document. Oops, too small to read. Very small print. Okay. And there's like a million questions in here, but oh, did I misspeak? I'm sorry. What did I say? It's retirees before the age of 65. Yes, this plan is for pre-Medicare retirees, pre-Medicare retirees. I don't say under 65. That's not under 65 because not everyone is an under 65 retiree can be on Medicare if you're on disability. So I say pre-Medicare. You're not a Medicare retiree. Let me see. Let me see if I can make this a little bigger. I just won't be able to show you then the whole, yeah. I won't be able to show you the whole chart then, unfortunately, if I make it any bigger than that. But you can, Katie said she posted the link in the chat on YouTube. I will send this to you so you could see it at your own, at your own leisure, okay? But let me see if I come back and see how you're able to see this. Nope, it's not letting me do it. Yeah, the print's just going to be too tiny. So I will send this in an email tonight. And if you are able to open up the UFT website, you can see on the link that Kate posted to what the health benefits are. So it is a concern for many of us because what we're seeing here, the primary issues that we have are that we don't have all of the answers. You're not telling me who's in the network, so you don't know what the costs are. And in the green highlighted area, so on the left side of this document, when you look at it later, you will see it'll list on the very first column, preventative services, routine eye exam, pediatric eye exam, routine hearing, primary care visits. It'll list all the services. And I know there's more services than that. And I don't like that this is not a complete list. That's my other peeve. And then the next two columns is current as administered today, which is comprehensive benefit plan by GHI with Empire Anthem. And then it'll tell you, in network, out of network, what your costs are under the plan today. And so most of those services would say, like, after the deductible is met and your deductible was like 200 individual, 500 family, then you pay the difference between the plan allowance and the provider's fee. So now if you see a health and hospitals doctor or an Advantage Care physician network, then there's $0 copays on this first page, right? If you see an in-network doctor that's not from H&H or ACPNY, then in some of these services, you're paying $15, $30, you're paying $10, depending on what the service is. If you're paying for an out-of-network, you still have the $200 deductible if you're individual. You still have a $500 family. And again, the plan deductible is met. You pay the difference between the plan allowance and the provider's fee, but there's an asterisk. And that asterisk says, if you look at the bottom, it says provider payment at 100% of Medicare. Even though you're not on Medicare, they're using the Medicare rate that's up here. They're using the Medicare rate to determine what you're paying. Now, it would be helpful. Remember transparency. Let's keep going back. Transparency. You need to know what the costs are. If you don't know what the fee is, you don't know what you're paying. And that's a huge issue, right? Many people, especially if for example, like myself, I go for an infusion every month. If I was on this plan, I would be concerned because what am I paying? If you go to the hospital and you're either an inpatient or an outpatient, if someone is unlucky enough to need several infusions at an out-of-network hospital, and I will tell you, my infusions have been at out-of-network hospitals, you're looking at paying like $9,200. And that's why it's important to know what hospitals are in the network for this plan. We can look up everywhere elsewhere on the United Healthcare website, but they're not giving you a link. And if they were going to roll this out, especially over a holiday weekend, you should have been able to look up who your doctors are. Don't tell me my doctors are in the plan. We don't trust that. Don't tell me, show me. I want to see the network. Let me see that my doctors are in the network, because what did they do to us the last time? Every doctor will take Medicare Advantage. That was bullshit. So, that's a concern too. And also there's a lot of concerns as well, with some of this. Let me see if I go down to the next slide. Don't stress out. I will send this to you guys. Okay. I mean, I know that it's frustrating, but, they definitely could have made this easier to see. Your facility charges, if you, again, health and hospitals or Advantage Care physicians, you're paying $0. If your in-network is $300 per stay, $750 max, which is typical what we've been paying now, right? Now, out of network, again, you're paying $500 per stay, $1,200 max for those copays, and then 20% coinsurance with the $2,000 max. That's a lot. That still is what you had on the current plan, but depending upon the network, again, I can't tell you if your doctor's in the network or not in the network. So the same thing with outpatient surgery. If you're an out-of-network hospital, it's $500 copay, which is the same as before, per visit, and a 20% coinsurance and balance billing. They also had that in the same plan, and the same thing with outpatient surgery. So it could add up depending if your doctors are in the hospital, are in the network or not in the network. Your PTOTST. So before, your visits were $20. There's still $20 in the office visit. Your ST is $0 if you're at an ACPNY or health and hospitals. $15. I'm sorry. Yeah, $15 if they're at your primary care physician. $30 if at a specialist office. Out of network, the plan pays the deductible. After the deductible is met, you pay the difference between the plan allowance and the provider fee. So there's still a lot to learn in this plan. And again, there's an asterisk there, right? Medications. So let me come back to you and change the slide. Oops. And then don't worry, I'll go back and look at your questions, because I could see the questions are piling up too. So Your generic drugs, if you go to retail, you get a 30-day supply, 2 refills, 20% coinsurance with a minimum charge of $5 or your actual cost. So that'll kind of stay the same. On your mail order, mandatory mail order, 90 days, $12.50 copay. Prescriptions will not be filled at the retail after 2 refills. That's the same as before. The 90-day supply can be obtained through the pharmacies or through the selected plan sponsor. And that will change from before because they're, I think, moving away from like the Walgreens, Duane Reade's, blah, blah, blah. It's going back to that Prime Therapeutics. Okay. And then your other medications, brand name drugs, specialty drugs. But again, without seeing the formulary, it is really not easy to determine, to determine what this plan covers or not covered. And that's the critical concern that we have. This has to provide us with more information. You need to see the contract. You need to know what's in it. And that is a question. What hospitals are in it? They said that MSK and HSS were there, but what about NYU? What about Presbyterian? What about Northwell? What about Monty? What are the costs if they're not? I mean, that's really important to know. So those would be really important questions that should be asked to determine whether or not this is a plan or not a good plan. Mike says, in-network radiology is currently $100 copay. Does that change? Oh, let me go back and take a peek. Oops. Give me 1 second, because I think I just closed it. So, your diagnostic x-rays, diagnostic laboratory, complex imaging, diagnostic complex imaging. So if you were to use Health and Hospitals and ACPNY, I got to make this bigger because I can't see this. It's a $25 copay. If you use an in-network standard provider, it's $50 preferred, $100 non-preferred, so you're basically out the same. And if you use an out-of-network, after the deductible, you pay the difference between the plan allowance and the provider fee, again, at the Medicare rate. And so I don't know what the Medicare rate is because I would need a CPT code. Laura, they're using the same vague, tricky language that they use for Medicare eligible retirees. How can this not be deliberate? But again, I can't tell you if it's a good plan or a bad plan because they're not sharing you the one thing that you need. Well, you need the contract and the full contract, not the 150-page contract. You need the contract, you need the formulary, you need the prior authorizations, you need it all. And you need the network. The network is critical. Is this for retirees on Medicare? No, Cora, it's not for Medicare retirees. It is only for non-Medicare retirees and active workers. That's who this plan is for. I said that in the very beginning. It's non-Medicare retirees and active workers. So no Health and Hospitals on Staten Island. And Susan, let me tell you a story. So back in like 22, I think it was, I had said to Michael Mulgrew, and I said to Michael Mulgrew, why would you agree to tiering hospitals? Because at the time they were, Henry Garrido kept saying he wanted to tier hospitals. And I said, why would you agree to tiered hospitals? And he started to chuckle. And I said, sorry, Henry says, well, I wanted, first my Henry story. Henry says he wanted to tier hospitals. And I said to Henry, why the hell would you tier hospitals? Well, it's just, we need to make money and we should make everyone go to Health and Hospitals. And if they don't go to H&H, then we should charge them more money. And I said, why did it not get it put into place? Because he's been talking about tiering hospitals for the last 5 years. And he said, well, Michael Mulgrew killed that deal. And I said, why? And he said, he lives in Staten Island. And I'm like, there are no Health and Hospitals on Staten Island, which means if you live in Staten Island and there's no health and hospitals, pray to God there's an ACPNY, because I don't know if there's an ACPNY because I'm not on this plan. We didn't get that far. Then you're paying the higher copay. So at the time, it was just about an H&H hospital. If there was no H&H, then you were paying a copay. So you guys could let me know that are on this plan that live in Staten Island. Are there Advantage Care physicians in Staten Island? I'm going to hope there is, because I don't think Michael would have agreed to this plan if all of the teachers living in Staten Island would have to pay more money simply because they lived in Staten Island and there wasn't an H&H hospital. There wasn't health and hospitals there. So if there is no H&H and there is no ACPNY, yes, you are paying more. But because we don't know what hospitals are there and we don't know all the copays, I really can't tell you if it's a good plan or not a good plan. I don't know. And so when I said that to Michael Mulgrew, he wouldn't answer the question. He just laughed at me. That's okay. I get laughed at a lot, but that's all right. Vicky, there are at least 2 ACPNY offices on Staten Island. Okay, great. Thanks, Vicky. I appreciate the intel. That's wonderful. They're not in New Jersey. Okay, but if you're in New Jersey, you're probably not using ACPNY and Emblem. You're using United Healthcare. That's my belief. Yes, but it's only outpatient. Oh, okay. Highland Boulevard and Clove. Okay. I think the MLC needs some serious help. Listen, we've offered our services. And let me tell you. So you heard me talk about the first union that supported what we were doing, right? The very first union back in I think it was 23. Said, hey, all my retirees keep sending us your videos. We don't know who the hell you are. What the hell is this fight? The last union president made a deal with Aetna, and they went ahead and throw them into this Aetna Medicare Advantage plan, and they don't want to be in it. They showed me your videos. What the hell is this? I said, where's your last union president? He goes, they hired him at Aetna to sell Medicare Advantage. So that union successfully stopped his members from being forced into MA after he and I sat very diligently and went over his contract, right? Now, let's fast forward to this last year, over 2025 and into 2024 and into 2025. All of the transport workers unions, and there's 6 of them. So you have TW 100, which is the largest union in the city for transport work. TW Local 100 forced all their retirees into Medicare Advantage, and they're still fighting that battle. Then there's 5 other smaller unions. The 5 other smaller unions said, no, we don't want to do this. We're hearing all these horror stories. Can you help us? And I said, sure. So I went to a virtual meeting with all of these unions and their union lawyers, and we all sat and we discussed it. 3 of those unions so far changed their bylaws to their unions to prevent Medicare Advantage from happening unless a large majority at an in-person meeting of members agreed to do it. And then at the bargaining table, beat back management not to do it because we educated them to go to the table and fight it back. And they did. And so on my radio show, starting on, I don't know, probably the end of the month, end of September, you will start to meet those union leaders. Very, very powerful, especially I was hoping to do it ahead of Labor Day, but one of the gentlemen he had to have surgery. And knowing that we fight for healthcare, I was like, take care of you first, and then we'll meet with you after. So it's powerful to be able to say 3 union leaders here in the city of New York listen to us. Nate, so you want to know which union went to work for Aetna? It was someone from a Connecticut police union, not here in New York. So we're good. Laura, I recall hearing that the MLC was struggling to financially stay afloat because it paid so much their expensive attorneys and their consultants. Been wondering how they're doing. So I don't know. I haven't seen a financial, but they were also like $750,000 in debt to their consultants. And I'm sure they're racking up the bucks now too. Let's see, where did that, oh, here. Your services are filled with misinformation. You are constantly asking for money that don't give transparency on where it goes and where. So Lorraine, I don't know who the hell you are, but you're welcome to go look at all of our financials up on the IRS website because they're there for everyone to peruse. Our services are not filled with misinformation, and we ask for money to run this organization and to fight litigation that I'm assuming maybe you're a UFT person who has some of those union leaders have literally forced retirees into this situation. And if you are from one of those unions, then you should have been worried about why your retirees were being stolen from to fund active union contracts that they didn't benefit from. That is the misinformation that you were told. So I don't know who you are. I'm not even gonna assume where you're from, but I'm just gonna tell you, great trolling, but you don't troll in my space. We bring receipts on everything that we do. We call out the bullshit. We bring facts, and this is why for 4 years we have won every case so far, other than the last little decision that turned it back to the Supreme Court. But we have been right with everything that we said, and that decision was made by a politically appointed court. Sorry, Lorraine. Learn by what you've learned here. We've proven to you that Medicare Advantage is a lesser plan than traditional Medicare. It is a privatized for-profit plan fraught with prior authorizations that deny and delay care, and wrongly in that matter. And that Aetna was one of the worst purveyors of that at over 13%. And also that many doctors and hospitals don't take the plan. And Aetna's lawyer admitted in court, Lorraine, my friend here, that there would be instances in which retirees would not have access to their doctors and hospitals, as well as could potentially be denied access to healthcare that their doctors felt that they need because of a medical decision made by Aetna. And what did the judge say? Well, Aetna lawyer, if that's the case, because you also diminished the fact that a woman died due to a business decision, the judge said to the Aetna attorney, "Dear, I'm so sorry that this is what you believe, but if to this court, if a person died due to a decision, a business decision made by Aetna, that is one person too many." And so, yes, Katie is telling me that Farinini is a retiree liaison and coordinator of the UFT Paris support line, which was established to help New York City paraprofessionals navigate retirement. So, Lorraine, if you are a para, then you probably make a crappy salary like the rest of us do, but you're probably making twice your salary because you work for the union. I hope it was worth your 15 minutes of fame to show that you don't know what the hell you're talking about. You want to come on my show and try to talk smack about what we're doing? I'm going to prove you wrong every hour I get. John, the UFA will participate in the MLC general membership meeting at the end of September, where there will be a ratification vote. We are currently reviewing so that's what the UFA said. Yeah, so I'm hoping that they, you're free, John, scribble down some of these questions. We're going to try to do a cheat sheet of questions that we have that union leaders should be asking in that MLC meeting, because we really can't, make a decision. Union leaders should not be making a decision without all of the facts on this plan. So that's really important. Janet goes, bye, Lorraine. Go, bye, Felicia. True unionists benefit when any member benefits. And you know what? A true unionist will also protect their retirees. And that's part of the disgust that I have for some of these people that are blinded by loyalty and not competency. You don't try to steal healthcare benefits from from retired union members to finance active workers. She, I'm sure, and like her colleagues, make well more money than most of us. And that disgusts me that she'd be willing to steal from you, a retiree who earned and paid for your benefits, so that she could one up on you. And that's a problem. That's not union. It's anti-labor. It's anti-retiree. It's ageist. It's discriminatory. And I don't stand for that. And I will call that out as much as I can. So let's see. Amen, Ismail. I hear you, brother. How many union MLC, how many unions are they? So 102. And that's if they all decide that they're going to freaking show up. Yeah. Mike, John, UFA, John G, UFA has a copy of the actual contract. No, Mike, I don't think they have an actual contract. So what everyone's being told is that they will be given, I think it's September 8th, 1 day to in-person review the contract. We might do a live that day. I will find out the day it is, and maybe we'll send a truck to record that day what's going on. I know they're not going to let us in, but we'll figure it out. And Elizabeth Bishop, I retired on January 1 of 23. I went on disability. I now will be going on Medicare at 61 because I've been on DB for 25 months. So grateful. I will be an old-fashioned Medicare. The Medicare Advantage is horrible. I've had a hand booed from Social Security Association. It's so clear what the differences are. Read people. Amen. And I'm very glad. I'm sorry you're in that situation. Let us know if we can help you. What happens if we vote no? I'm leaning towards a no vote. So Nate, a no vote, I would want to, I think I know who you are. Feel free to call me later. My opinion on this is right now, demand to see the contract, and no vote should be held unless you've had time to review this contract and you've had time to review it with your board and had the time. So my belief is this. My belief is that every union member should be able to have a union, be given the contract and sit with their board to chew on this. You've got to research this. You take longer to negotiate your union contracts than they're doing this shit. And this is exactly what they did. Is yesterday at UFT's healthcare meeting, they said, this has to be done. We need to do this now. We have to take a vote. I have to call the mayor. No. Time out, guys. We don't negotiate this way. You take 6 months to a year, and sometimes that's because of the roadblocks that OLR puts up in front of you to negotiate these deals, right? Negotiate your contract. Why are you ramming this through in 30 days? You want the whole contract? You want your entire board to be able to look through it, review it, and ask questions. This should be done over a series of months, not 30 days. And then your members are due the same courtesy as you. You have members, and I don't remember your specific union. Maybe your people all work 9 to 5, maybe they don't. If you're EMS like us, we work 24/7, which means the union would now have to have in-person meetings where the union members can come to the union several days in a row, maybe several weeks in a row, to hear your presentation on this contract and to say why it's actually a good contract, if it is a good contract, or it isn't. Because how could you vote for it if you haven't researched all the details? And I'm telling you right now, the Aetna Medicare Advantage contract was over 10,000 pages. There is no way in hell this contract's 150 pages, as I was told today. I laughed so hard. I said, did they tell you there's a formulary? Where is it? Is it in the contract? Formularies can't be 150 pages. There are thousands of pages. You have thousands of drugs. What are all the prior authorizations in this? What are what doctors, what hospitals are in the network? You need to ask those questions. So I don't want to say vote no, because I don't know if it's a good plan or not a good plan. What I would say is I don't have enough information to make a vote, and you should actually pass a motion. I make a motion that this get tabled because we don't have the information to make a decision, which just means if that's where you're going to lead, I would hope many of these unions who were burnt in the last couple of movements that the MLC made would urge the MLC leadership, whoever the hell they are, other than like Michael and Henry, because I do not know who's acting president at this point, and the steering committee and your executive unions like Greg Floyd, Gloria Middleton. So these people, you have to demand that they give you the information that you need to bring to your members to make an intelligent decision, because your vote, every one of your votes, affects not just your retirees, but you're active workers. And again, unions don't represent retirees. There is no retiree at that table to say, yes, this is beneficial. So, I mean, we joke around all the time that unions should be encouraging the retiree organization like myself to come to this meeting and say, hey, this is a great plan. This is not a great plan, right? Or even share information. Like, for example, why does Gloria Middleton get to go to these meetings and so does Arthur Shirley-Otis? That should not be allowed. He's supposed to be her alternate and shouldn't be in this meeting. So my short answer is you're leaning towards no, but I would rather see that you form a coalition, collective action, and you get a large group of unions to say, we don't have enough data and we don't have enough time. This is not the time to vote on this. We need more information and we need more time. If you can defer that, that might be the action to go. This shouldn't be rushed like this. This is life altering for people. If you make a decision that impacts them, that could potentially leave them without a doctor or a hospital or some crazy ass formulary or prior authorization, get those answers. And if you need help with understanding it, there's definitely a group of us who are used to doing this, you know, that will be willing to help you out. Okay. Anyway, let's see. What else do we have? Oops. There's a lot. Let's take that one down. Oops. Get Tom DiNapoli on it. Looking forward to hearing from those 3 union presidents who changed their union constitution to prevent the unions from forcing their retirement. I am so looking forward to that too, my dear. I was really hoping to have them on for you this week, but yep. Awesome answer, Mary. You're welcome, Dawn. I appreciate you. Absolutely. And, you know, and we were talking today, me and Joe Maniscalco, about the power of collective action and what it brought to us. You know, you could have any troll come in your space at any time of day, but when you are a retired person and not in a union, and you, as we did, our organization did, was bring over 50,000 retirees together to stop the city from forcing us into a predatory for-profit Medicare Advantage plan and litigate the city in 3 different cases. We've been pretty powerful on that. I think here's another thing that was told to me today. So a couple of reporters we were meeting with today thought it was kind of interesting that they could call to congratulate me about being in the City and State magazine, about being number 15 in the top 100 labor leaders in the city. And I said, you know, what's an interesting fact is that everyone else on that list is active and makes like 6-figure salaries. I'm the only retiree and I work for $0. Like nobody else does that. So it's kind of an honor to be in that position of saying I'm in that 100 top labor leaders. I'm identified as a leader and well ahead of a majority of most of the active union presidents, which is quite stunning. But it shows you that the power that this organization has in protecting what you earned and your benefits and being relentless at that, and that you're not going to give up until you truly won what's right for your people. That's what collective action is about. That's what trade unionism is about, not, you know, this BS of lying to your members or trying to pass them off to get something from someone else because you're not an effective leader to actually make that happen for them. We should never have been in this fight. And unfortunately, some really bad labor people made some bad decisions, whether it was because of greed or because that they were misled or maybe a combination. So we're just going to keep forging on and doing what we do best. And you guys know how to do it best. So I'm glad we're in this fight together. So let's see what else we have. Yes, MLC members are union leaders and are only allowed one person to see the contract. Yes, absolutely correct. So I am proud that we're on this fight together, Janet. Times are changing. Marianne rocks. You guys rock too, because I couldn't do this without you. Yay, Marianne. Hey, Camille. I mean, it's just crazy. You should have been number one at the top of that list. I know a lot of people told me that, but yeah, well, there's always next year. I'm sure Henry would have had a vein pop in his forehead if that happened. He probably wouldn't have liked that. Make a T-chart with pros and cons, present it to the MLC members. We use this in the classroom. Maybe Kate can help me do that. I do not know. Let's see what. Ooh. We have to be careful if we vote no. The OTPT people voted no, and Michael Mulger didn't accept them and made them revote. See, that someone should have sued him for that. You don't say, I don't like the election, let's do a revote. That's not really good. True, but this affects some retirees. The non-Medicare eligible ones don't. The people on the listserv realize that. Our people recognize that this is a non-Medicare plan. We've told them this is a non-Medicare plan. Some of them have been talking to us about it, so they are aware. Let's see. In the spring of 23, I was asked to be on a UFT committee to discuss healthcare coverage and insurance plans. And now here we are 2 years later, particularly metastatic breast cancer issues. I attended one. They did not want to hear what I had to say regarding Evacor denying PET scans for cancer patients. The meeting wasn't for that. Then what are they talking about? Standards or lack of care? Imaging saves lives. We know who, what we are in back rooms and making. So, Anne, thank you for that statement. That is exactly an issue. And also, are those prior auths being done by AI? Will they be reviewed by a true human medical practitioner? I want to know that they're being reviewed by a doctor. So these are all really great questions that should be asked. This is really important. I think I'm really hoping that after everything that's been done in the last several years, people listening to this event, which I will repost. It'll be on Facebook. It's currently right now streaming. For some reason, my link to LinkedIn broke, but I will upload it there if it lets me. It's on Facebook, it's on YouTube, it's on X, and it's on Instagram. People are watching this. We have right now over 1,000 people just on here alone watching what I'm doing right now. And that's why it's important to take our time and go through and explain this. I can't tell you that this is a bad plan, and I can't tell you it's a good plan. It's because I don't have the contract. You don't buy a house, you don't buy a car without knowing those details. And you shouldn't be buying a healthcare plan unless you know either. And so, Nate, if you're still listening, the judge in our case stopped the implementation of the Medicare Advantage plan because he said that he gave an injunction, stopped it. You can't force these people into it because you don't have the answers to all of these questions. You don't know who's in the network. Why is that one slide saying that these healthcare insurers promised that they would bring all these highly used doctors in? Well, why don't you get them in the plan first and then unroll it? That would make more sense. But I mean, I'm not at the table. I would want to see the contract. I would want to see the network, the hospital network, the medical formulary, the prior authorizations. This all has to be viewed. You cannot make a decision without viewing this. You can't. And that's exactly what the judge said in our case. He even made Aetna go back and made a document specifically on all of the prior authorizations. They had to say how many, and they had to list them. We had to know that. So a lot of that information, super important. Judge said you need to be able to know who's in it, and you need to be able to know what the prior authorizations are. You have to know this information. So use that. Try to form a coalition with your colleagues. This might be a great plan, but unless you have those answers, you really can't make a decision, and you shouldn't be forced to either. Maybe getting it done before Eric Adams leaves office or is reelected, or January 1st, whatever the importance of January 1 is. Maybe July 1 is the date. Maybe you say 6 months from then. Why don't we take our time? If this is really a great plan, and that's what we were saying to them over the Medicare Advantage, if you are who I think you are, when we said, if this is so great, why are they not taking more time to let people be comfortable about these decisions and about the answers, right? That's really what it comes down to. If it's really that great, it'll be okay in July or be okay in April. Give us more time to make sure that our boards are comfortable with the decisions that we're making. Because if we're not, it's on you guys. And that's going to cause litigation somewhere. Maybe not from us, maybe from us, maybe not from us, maybe from someone else, maybe it's from someone else that's pissed off. I can't tell you who, but it's possible. Let's fix it before it gets there. That would be the smart thing to do, especially with the time and money that the city and the unions have spent on this. I mean, remember the MLC financial? They owed Siegel over $750,000, and they didn't have the money to pay for it. They were trying to raise MLC dues. So keep that in mind. John, no. Lorraine Farinini, Department of Education, $134,784. Sub-agency type pedagogical type teacher, special education rate is 105. Yeah, and see what I'm saying? Is she's literally like profiting off of union dues and slamming fellow union members. She doesn't even belong in that position, and she doesn't belong in a leadership position, and she sure as hell doesn't belong in a union if she's okay with, screwing retired people out of their healthcare benefits. Let's see. We need a roster of MLC members. This should be public record. Okay, great question, Long Beach. So we actually foiled that, and the city refused to give it to us. If you go back on our website, we have a list, a poster of all of the unions. Let me see if I make that down as my notes. I can actually post that for you. Because I was actually thinking about sending them all a letter as well. And if you guys would like to do that, that would be really great. You can, or even call them, because they're probably at this point, we've sent them so many emails, they're hiding their email addresses. But you could still call their union and leave a message, or write them a letter the old-fashioned way. So I will say post unions in MLC. Okay. I will work on that. Let's see. I can't even understand how the United Healthcare contract was considered okay by the Mayor's Office of Contract Services and the New York City Comptroller's Office in terms of integrity to be able to even be considered a responsible contractor. United Healthcare is being sued by the feds successfully for fraud. So I will tell you, I have reached out to Brad Lander 3 times, 3 in like the last week, I think, and I got no answer. I'm not quite sure Brad wants to answer that question, but that is one of my, I think, 3 questions. I'm not really happy about that either. Serena Mia, I have an email from the PAC listserv that said the MLC doesn't expect actives to fight like the retirees. I'm paraphrasing. I will literally tell you, someone said that to me today, but not about PSC, that the retirees have more union in their pinkies than do the active workers. And I actually laughed. Now, there's a couple actives on here. I give you kudos because I know you guys are fighters, but the majority are pretty much asleep at the wheel. We will bite when we have enough information. Perfect. I mean, doesn't that not make sense? I know, totally crazy. I think we need to recognize the goal is to privatize public service employees and retirees' health insurance. To that end goal, these labor unions are to tally and stride with Project 2025. And sadly, most of them are, and they don't understand the difference. Vote now until the contract is provided and we're allowed to study it without getting rushed. And there's a motion for that, and I forget what it's called. Nate probably knows it better than I. I don't remember my parliamentarian speak, and I really suck at that. But one of the things that they can do is they can call a motion that there's not enough information to take a vote. And they have to do something about that. If anyone on here is parliamentarian or understands Robert's rules on calling that. There's a motion that has to be called that you don't have enough, but it's a little bit more than just abstaining. There's something else, and I don't remember what it's called. We must trust our leaders no matter what. Okay, so Jazz Snare, I'm going to disagree with you on that. If everyone trusted their leadership on the Medicare Advantage plan, and look where that got them, they were lied to. You were going to be forced into a plan that had prior authorization, that took away the ability, became a great gatekeeper between you and your doctor, that many of your doctors and hospitals didn't accept. They believed a lie by the insurance company who was selling an insurance to enrich itself. That's a problem. So I will also tell you, you must always question what you're told from even leadership. You should not just take a blanket order from someone without checking. I disagree with that statement, and that's why. Because sometimes they're not right. And in this case, they weren't right. So I disagree there. Maybe you trust them, but you fact check what they said, because you just shouldn't blindly, yeah. Oh, you were sarcastic. Geez, thank you. That didn't come across here. Woof. Not sure. We'll look it up. Tabling the motion or something a bit stronger. Yeah, something like that. I'll Google it after this call. Yeah, I'll help you Google that, and I'll make a phone call to ask, because I think my friend Neil, you might know my friend Neil. Neil might know the answer to that better than me. Trust but verify. I like that, Matthew. Yes, I like that better. Yes, absolutely. Why do you think the UFT put all this info out yesterday when my neighbor cops in FDNY got nothing and the other labor unions were told this was confidential? So, Katie, I can't answer that question. Many of the people were told, many of the union leaders were told that they could not distribute this. And that's why I was shocked to see it up on the UFT website. I think that there's a reason, is that they're trying to control the conversation and the narrative. And, you look, your union's 200,000 active members and 89,000 retirees. That's a behemoth. That's a third of the city workforce. If in fact that's the case, then they're going to want to push this through. And what I heard about the UFT Health Committee meeting, how that meeting went, they jammed that through. It was not a roll call vote. They did not give the contract. They basically had what we showed you, and 40 people in a room were asked, does anyone have a problem with this contract? And no one said anything, because they didn't have a contract. And then Michael Mulgrew allegedly took that as a vote. And that's not a vote. But they all were shocked that it was interpreted as a vote, passed it unanimously, and he ran and dialed the mayor and said it's a deal. So people are a little freaked out by that. And that's a concern. And I would be concerned about that too, because now does it look like it's a rubber stamp for the delegate assembly to go ahead? Well, the health committee looked at it and they're a specialized health committee. But then when I'm talking to some of those people that are on the committee, they're telling me they're not health specialists. They don't know health insurance. They weren't given the contract. They didn't see the formulary. They don't know what the prior authorizations are. And they don't know who the hell's in the network. Now, how the hell did you pass this? So that's my problem. So even if Michael Mulgrew does support this plan and his committees have rubber stamped it, I'm hoping all the other unions at the MLC raise a big enough stink to slow this thing down. Because if not, and enough people feel that it's not, they don't have the answers to make this plan, someone will sue. the city, whether it's me or somebody else. We still don't have enough for our attorneys to make that decision yet, but the city shouldn't want to be put in this situation, again. It should really want to fix this the right way. They should have learned from the mistakes from before. So that's what I think about that. John, dinner's on the table. We'll see the rest of the presentation later. Keep up the fantastic work you do for all of us. Love you, John. Take it easy. It's good seeing you today. Long Beach, I think Mulgrew can't believe the retirees are so active. Let's go. Support 1096. I want my 1096 cap and t-shirt. Okay, so Long Beach, listen. You better show up on the 2nd at City Hall at 10:15 a.m. to start getting through security. We will all be there. I'm going to be there super early and make sure everything goes well. We'll have some signs to pass out. We're going to tell them, thanks for what you've done, but, happy birthday. You're 65. You truly are one of us right now. You're Medicare eligible. And please get the speaker to do this, to get 1096 to the floor. We need 1096 to the floor for a hearing. And I would really like to see if Michael Mulgrew really does support retirees, he'll stop saying that this bill is illegal, get it to the floor. And if there's a language tweak that he's looking for, we're open to that negotiation, but we're not open to negotiating reducing our healthcare benefits. And so that should be open as well. He should be able to say what he thinks and what he doesn't about making it right. He can't just say that I don't like this or it's illegal. He should tell us, I agree with you. You should protect yourself. And this is how you could do it. So if he thinks he's got something to offer, we were also told that the language to our bill couldn't be changed until it got to a hearing out in the committee. And we should be having those committee conversations. And I'd be glad to sit with him and go through some of that conversation personally with my attorney and his attorney without any problem. And he knows we can have those conversations because we've had them before. So if he really does want to help, and Bennett should be doing this as well with the United Federation Teachers Retired Teacher Chapter, is pushing this to happen. And if he doesn't, then we have another problem. But the Retired Teacher Chapter should be going, now's the time, dude. Has the Retired Teacher Chapter heard about our rally on Tuesday? Are they coming? I have no idea. That's my concern. So let's see. Today is day 1 with 29 more days to review all the information and ask questions you need answers. Sounds like you already are against this after just 1 day. No, I'm not against this. I do not have enough information to make a decision, and neither do you. And I don't know who you are, Rob Scott, but anyone who is tasked with making a decision for a healthcare plan for 1.2 million people or 1 million people should definitely be looking at all of the questions we asked. Why? Because their life depends on it, and so does yours. Blind loyalty doesn't get you anywhere. You should have learned that with what they did to us. I'm sensing a lot of unity people in here today. Gee. Blind trust frequently has unexpected negative consequences. Yes, it does. Yes, it does. Mike, trust them. I wouldn't trust Garrido and Mulgrew, even if they had their tongues notarized. Oh my goodness, that's hysterical. You guys are funny. Patricia, Mulgrew's going to try and push this on CLs and delegates at the meeting on Tuesday. I don't doubt it, because I think there's something in it for him to have put out all of this information ahead of all the other unions, preempting everybody when everyone else was told not to, and then not putting out all of the answers. Look, they want you to know only what they want you to know. And the 2 documents that they did share aren't enough to make this decision. You would not purchase a plan on the Affordable Care Act website if you didn't have the questions I'm saying to you now. So this should be super critical. And this is also what tells you that these people shouldn't be making this decision, because if they did have to purchase a plan on the Affordable Care Act, they're there for a reason, is to purchase health insurance. They're going to want to know, are my doctors and hospitals in the plan? They're not going to want to listen to someone saying, yes, they are. We've been lied to for 4 years. We've proven that. We've proven that in the network that they gave us, that some of those doctors were dead, some were retired, some were penalized by the New York State Department that penalizes doctors for doing criminal activity. Some of them were no longer accepting new patients. You should know this ahead of making a decision. This is a purchase. This is something you're relying on for you and your family's life. And they have to take it that seriously, not flip like they did yesterday. So absolutely. Jazz Snare, this plan is for non-Medicare retirees. It does affect retirees, non-Medicare retirees. What happens if retirees are already on Medicare? Yes, this doesn't affect us. Medicare retirees, this plan isn't for you. If you're on Medicare, this isn't for you. I said this in the beginning. This is only for active workers, non-Medicare retirees. I mean, you guys have been given plenty of questions in me going over these 2 documents that should be asked. No one should be making an assessment that this is a great plan or this is a bad plan. You don't have enough data to be able to make that assessment. Margaret, to table a motion in Robert's Rules of Order until more information is available, a member must make the subsidiary motion to lay on the table, which requires a second and a majority. And I will tell you, even if they don't secure the majority, it was made, and that should be enough, even though it probably won't be, but it would be enough to cause an uprising. And there better be an uprising in that room if that's the case. If all the other unions say we don't have enough, thank you, Margaret, that's great. I appreciate you looking that up for us. There should be plenty of people willing to say, nope, time out, guys. You screwed us with rushing this damn thing before, once before, twice before. Let's do this the right time. There's no reason to rush. Yes, it's risky by rushing. Let's get all the answers that we need. This is to Michael Mulgrew. When someone shows you who they are, believe them the first time. I'm hoping, CJP, that many of the union members that were burnt the last several times or the last several years in the MLC heed that advice and get the answers that they need. Hopefully the mayor got pounds of birthday cards from us. I hope so too, Ellen. That would be great. Laura, one of the deepest frustrations I have is how many progressive officials who supported us before have turned their backs on us as they look to get employed by Zoran. This is awful. I keep insisting how true Zoran supporters should show him some tough love by demanding that he commit to us retirees. It doesn't make any sense any other way. I hear you. Jazz Snare. I like Sliwa, but the most significant thing he has done is to remove his beret. I don't think that's enough to win. So many people have said that he looks a little different. They're not used to seeing him without his red beret. Long Beach. Yes, we're going to have everything to back us up regarding the New York State Open Meetings Law and New York State Comptroller's Office. Tom, by the way, is Italian. This is serious business. It absolutely is. This is life. People rely on their healthcare. They took their jobs. They took their jobs for healthcare. They took their jobs for pension. It was reliable. It was something that they can count on. That shouldn't be just, thrown away. For the record, I am not and never will be Unity. Oh, Marie, I knew that. Will pre-Medicare DC-37 retirees still be able to choose DC-37 med team? That's a great question, Mike. So what we're being told is the other plans will still remain available. And since a majority of people, like 90-something%, are on the GHI plan, it's likely that they will just move over to this, that is going to transition them all over to this new plan. But will you be able to? Have not seen anything that said no. And that would be another great question that all those other plans. I have not seen anywhere in these documents that all those other plans will still be there. So Nate, if you're still listening, that's another question, because DC 37 does have DC 37 Med Team, and DC 37 Med Team was GHI. So if Nate is still on this call, that is another question for a DC 37 union: will Med Team still be available for an active worker non-Medicare retiree? Because I would not, and if you would, please also ask if DC 37 Med Team would still be available to anyone, active or retired, Medicare, non-Medicare, because you do have people that live in Florida that are on the DC 37 Med Team plan. So if Nate, if you're still listening, or any DC 37 union listening to this, that is another important question to ask. Great question, Mike. Thank you. KE, they're worried that you will educate the actives. Oh, KE. They don't know what's coming. We have been right this whole time. And so that's what's important about this. And this is why when I took this approach, after everything I listened to, everyone says, are you going to be against this? I'm like, I can't be against it, and I can't be for it. This is the perfect time to educate people of what they should be asking. I can't tell you I'm against this, and I can't tell you I'm for it. We don't have enough information to make a decision. And knowing what we went through with the courts, the judges literally put a preliminary injunction on the plan that they were trying to force us into for these very same reasons. Answer the questions. Let's hope that they can get that out very quickly. Yes, we are in a holiday weekend, but no union should be making a decision to do this plan without the information that we've raised. We won court cases before on this. So let's see what they do. Unity people surrounded by education. I know, oh my. Yes, clearly, like, that other woman was afraid to be educated that her brain might burn. Are you all going to sing happy birthday? I don't know. It's a good question. Do you want to sing? Come on out, David. I don't know. I'll let you know how we feel. I might not want to sing happy birthday. Maybe I will. Actives should be emailing voice of the people. Okay. Henry and Michael should know how retirees have their number. Oh, yeah. Well, we're used to seeing that. As I wrote on X, the labor bosses want us to buy a pig in a poke. Susan Edelman of the New York Post reposted my comment. Oh, I haven't been on social all day. I've been in meetings literally from 7:30 this morning. I will go check. Marie Para, me either. That's good. So we know more than 2 people here are not on Unity. But I could definitely tell you there's 2 in here right now. And they're definitely Kool-Aid drinkers. The unions are pulling the same tactic the government has been using by releasing unpopular news on Friday nights and right before a holiday. So times are changing. Listen, in FDNY, in emergency services, we also have this phrase. It's called the Friday 4 o'clock fax, and that's when we had fax machines. So management was always known to kick out an order or something at 4 p.m. and then leave headquarters and expect you to implement it without having any Q&A, no information, and it's Friday 4 o'clock. So it rolls over on the fax machine, and you're like, oh crap, now what? And of course, that's what they did. So it's all right. I mean, there's still time to fix this, and they have the time to do it. Let's hope that they do. I say this as a non-city healthcare person. This isn't enough info from city and MLC. Please ask the questions. And I agree with you, Katie. I shouldn't have the same level of info as the president of the UFOA and CSA, who are MLC members. And that's what we were told too. There were unions that told us exactly the same thing. We have what you have. Doris Wise in Palm Coast just checking in. Hey, Doris, good to see you. Jim Walden's recent social media has been great, and he's participating in the upcoming mayoral debates. I think that's fantastic. I told him if he'd like to come back, yes, but pretty cool. Yes, though I'm UFT. Oh, Nate. So then you're not who I think you are, because I have another Nate that I know that's DC 37. But so thank you. But that's a great question. If you could ask, even though it doesn't affect you, although I will then ping out to some DC 37 unions and ask them if they would, if DC 37 Med Team or any other plan that's currently offered including DC-37 med team, would still be available to a non-Medicare retiree and active worker. So, and just so you know, if you're not familiar, since you are UFT, DC-37 med team, DC-37 is actually the only union in the city of New York that, quote unquote, has its own healthcare plan. And it was called DC-37 med team. It was founded in the 60s in case situations like this, like for us, Medicare retirees, and for active workers, if there was ever a time when the city would try to force you into a lesser plan or diminish your benefits, that DC-37 was supposed to stand strong with its own independent plan. And many unions in the late 60s and early 70s were encouraged by the city to create their own health plan. The only one that did ever was DC-37. That med team later morphed into a GHI plan. And so they kind of have their own like little stabilization fund and their own funding mechanism for it, but is only for DC-37 employees and retirees. So hopefully that explains what that was that I'm talking about. I apologize. I thought you were someone else. All these Mamdani loyalists, where is Mamdani tonight? Why is he not here? Well, we've been still trying and no response. We appreciate you, Marion. I appreciate you too, Long Beach. Thank you for listening. And thanks. We've kept a high response on this today. And that's why this is really important to try to break this down as easy for people to understand as the best that we can, because it's important. This affects all of us. Do you want political action groups of retirees in Nassau? Do you want political action groups of retirees in Nassau? So if you, Long Beach, we put out something on our Facebook page the other day to help out the Nassau County retirees. So yes. And if you search, I think it's like Nassau County Retirees Legal Fund, reach out to them and check that out, because I literally put a post up about this the other day. They're trying to get Nassau County residents to help them with the next election, because they're in a very similar situation like we are. Okay. So the answer to that is yes. Love you too, Patricia. It is 100% true that we should know which doctors accept a plan or new patients. However, no insurance company I've used has reliable info on this, even when you're on it, basically a coin flip on the site. So Swami 88, ghost networks are illegal in the state of New York. And so if this is a plan in the state of New York and there's a ghost network, I have an attorney for you who is actually suing insurance companies right now over ghost networks. Reach out to retirees at nycretirees.org if you are on a ghost network, and doctors and hospitals that you're calling on the network, that you call the insurance company and they say, yes, that's an active doctor or hospital on your plan. We can help you with that. There are two attorneys that I could think of right off the top of my head that we work with that are currently suing insurance companies over ghost networks. And this was a law put in place by Letitia James a couple of years ago. Okay. I'm not saying to accept this plan, but I haven't seen any insurance company competently or transparently present their information. And you know what? Maybe maybe with a presentation like this, where we kind of go through what we could share with you and explain it in a way that people can understand, that maybe it would make them be more transparent. I agree with you. Insurance companies lie. I don't really know of an honest insurance company. Many of them are just trying to say whatever they can say in order to sell a policy to make a commission. But yes, I agree with you. And yet maybe it's presentations like this that will hold them accountable or make them be accountable. I will tell you that some of the insurance companies for the city of New York said that they were worried about rolling out this plan, that there would be the Marianne factor. And I laughed at that, like, Marianne factor? What do you say? Like, if we don't do it right, you're probably gonna sue us. I was like, okay. I will still ask about DC-37 if you want. Sure, Nate, go right ahead. Absolutely. You could reach us at retirees at nycretirees.org. and me and the VP answer all of our emails. So if you want something specifically to come to me, just say, hey, please tell this to Marianne, and he'll just forward it. Or especially if I don't see it, at least let me know what you find out. And it's great because there was a period of time, and let me see if I can quickly pull that up. We filed a FOIA, a Freedom of Information request. And if I can quickly find it in my computer, I will pull up this document. So we filed a FOIA on all of the documents of all the people who were on what specific healthcare plans, right? It was really important for us to know who was on what plan, how many people were in what plan. I have like a million FOIA, so give me one moment. And the city sent us a response outlining who was in what plan. Now, let me see if I can quickly find it without having to search all the millions of ones that I have. And it laid out every plan that the city offers, and it also lays out how many people were in those plans. And it would be important because you do have people in other plans. Like we'd had people in a United Healthcare plan, which was like a Medicare Advantage plan. And this wouldn't be Medicare Advantage, but you had people in Aetna plan. You had people in other Oxford plans or whatever the plans were. There's like 11 plans that are offered to active workers and non-Medicare retirees. And so it was important to know, how many people were in each of those plans. I thought initially that what they were trying to do was eliminate some of those offerings that they had to people, but maybe they changed their mind. But I've not seen anything in the documents that they sent us that would say any of that. They haven't said that all the plans remain in effect. I haven't seen anything like that. I mean, maybe that's the case, but I'm just not seeing that. Maybe it's in opt-outs. No. So if I do find it, I will let you check one more. Was that it? Nope. So if I do find it, I will post it on our Facebook page, but it's just not jumping out at me. Like I said, I filed many of these and it's just not coming up. So, but there is a document that we have that shows all the plans that the city offers and how many people are in them. And we've done it every year. So that's a really important thing to have so that you know how many people are in the plans. And that if your members are on them, because I don't know what plans your members are on, if they'd be able to stay on them if they chose not to take this. Like there's people that choose to pay like $600 a month for Aetna and the drug plan. They want to be on the Aetna and they're non-Medicare, they're active workers. If they want to pay $600 a month, God bless them. There's like there's what's going to happen with the GHI-HMO plan, or is it just the CBP plan that's going away? There's other Medicare plans. There's other health plans that are available for active workers, non-Medicare retirees. What's happening to them? So that would be a good question. Let me know what you find out, because I don't see that in anything that they put here. Since retirees are not being represented in this process, there should be an injunction against forcing retirees into the new plan. Would that be possible? Mike, I'd have to ask about that. We would need a reason. We would need a reason for an injunction. And remember what the court said, that the unions were supposed to protect you, but because you're a retiree and you're not in the union. But even if they don't protect you and they don't stop you from getting screwed, it doesn't stop the city from implementing it all on their own because you have no representation. You have to hope that the union is, as which they didn't, would protect you and do the right thing by you. It took us 4 years in battling this before one of the largest unions walked back. And that was only after we helped unseat 2 of the union chapters, the retired teacher chapter, by supporting their retirees, as well as helping the paras, supporting the paras. When both of those, I think Mulgrew saw the writing on the wall. If he didn't start listening to the members, that there was a risk that he would be unsat as well. And some of the strategies and tactics that they took during this last election definitely shows that was a concern. where they were literally trying to accuse me of election interference when all we did was support people running in an election in a very freedom of speech way. Per emblem, under senior care, if one has more than one ancillary test by one provider in the same instance of care, one $15 copay. However, if the test is at a provider with facility fees, add a second. So, Matthew, could you send that to me? Because this Claire Levitt from Labor Relations is saying something different. And we have instances, many of them, including myself, where I went to one doctor. I got a doctor visit for that office visit. I had a test, and then I had a doctor read the test. And all of them were employees in the same office, under the same provider. And yet I got charged with multiple copays. And Claire Levitt says, that's okay. Her definition isn't, let's say, Dr. Barnabas, MD, is the provider, and yet you have a little x-ray and a little blood draw, and you have a little PT in the same under Dr. Barnabas, MD. No. If you go to Dr. Barnabas, MD, and then there's a bill from Dr. Barnabas, and then there's a bill from the blood draw people, and there's a bill from the radiologist, and then there's a bill for the facility, you can get hit with 4 copays. That's Claire Levitt's interpretation of what she interprets as provider. It's not Dr. Barnabas, MD. It's every doctor or whatever service offered in Dr. Barnabas's office is a provider. And that's a wrong interpretation. So send me what you have on that, because Emblem didn't say this to us, but Office of Labor Relations, Dean Weltman, Sang Hong, all of these people were in a meeting with us in November, and this is what they told us, exactly that. And no, that's not what we're being told. So let me know what you got, and I'll be glad to look into it. The copay, then radiologist copay, $45 in copays right off the bat. Yes, I agree with you. Yes. Now I see you have a second. Yes. Okay, so then I just affirm what you said. Can we eat potato chips on the steps of City Hall? Mary. Behave yourself, Mary. If 2 radiologists review the same image, another. Yes, yes, yes. That's exactly what we're fighting still. And that is way wrong. And this is what the unions did to us, is by imposing these multiple copays on us that they're racking up to like $60 a visit when we were told it would be $15. You're welcome, Carolyn. Thank you, Nate. And thank you for trying to help. I appreciate you looking into this and asking the questions. Where do we stand with copays past and present? We are still fighting the illegal copays, trying in that negotiation phase on them returning the illegally charged copays. And then the new copays, they're still fighting us and even fighting that. And this is why we need 1096. Thanks for all you do, an in-service UF team member. Thank you, Croc 1969. I appreciate you. I appreciate you listening as an active member and getting questions that you can bring back to your leadership and your chapter leaders and your colleagues. Thank you very much for joining us tonight. Med team was called Med Plan first. Yes. Vote for Seth Kozlow and Nassau to protect retiree benefits. Yes, that was part of what Scott and Jeannie were putting out. Thank you, Camille. There's not enough thanks in the world for what you do for us. Oh, JG, thank you. Oh, we're getting a rebate inflation check from Hochul. Just saw that on the news. Really? Will any New York City Council members be joining us on the 2nd? Marte, I would think. But what about ones like Brannon? Or is he still trying to get a Mamdani job? And bad news now. And we're bad news. Hold on. I think I'm going to text him that, because I texted him today and he didn't answer me. Let's see. Justin, are you listening to me? I would hope he would. Nope, he didn't answer me. Hold on. Let's see if he answers that. All right. I texted him your message. According to New York State open meeting law, the contract must be posted for the public 24 hours in advance of the meeting. Otherwise, the vote cannot be taken. Hey, Long Beach, can you send that to me, please? The Mary Ann factor. I'm a little behind here. Yes, I was told the Mary Ann factor. Yes. May I send you a photo on org, email a bill I recently got from an ER visit with a plan listed I knew nothing about? Yes, could you please do that? Interesting. I actually have Aetna. And so I'm thinking you're an active worker or non-Medicare retiree, and you're probably paying $500 or $600 a month with your healthcare plan, non-Medicare, and your drug plan. Because as a city councilwoman that I know who's probably watching this now too, who's paying about $600 a month for a drug plan from the city of New York and the Aetna plan, active worker. Sherry, thank you for all the info you've given us. Have a restful weekend. Thank you, Sherry. You too. Did you say MLC meetings are open to the public? No, they are not. But the healthcare plan is funded by taxpayer dollars. And that's why I don't like that they are only open these informational sessions and the viewing of the contract to MLC member unions only. So there are a few unions that I know of, including the few DC 37 unions that are not in the MLC. And they should have open transparency on these contracts. That this should not be hidden. And labor relations should require that this be shown. You should not be a member union to be voting on healthcare. Healthcare is a mandatory subject of bargaining. And the MLC is not subject to FOIA. So you cannot FOIL anything from them. And if you call them, they'll ignore you. You can't get an injunction against something that hasn't happened yet. Yes. Very good, Dan. That is correct. It has to be implemented for an injunction or imminently implemented. Because once before the Medicare Advantage plan was actually implemented, or was starting to be implemented, is when we got the injunction. Migda, like promising $10,000 to all parents. Yes, Migda. Yes, that's a perfect example. That is something like your union should have negotiated at the table when he had like $470 million to be able to do that, rather than try to pass a bill to get a council to put it in the budget that your raise would check, if that's what you're going to call it, would non-pensionable, by the way, be funded through a discretionary budget. That's a problem. And it's non-pensionable, which means you would, in order to keep that cash, have to stay working. He's made no plan for you to retire. That's a problem. And he put his failure on the backs of the council. I'm interested. You deserve this money, my dear. You absolutely do. Paras deserve, better pay. You absolutely do. I will give you that hands down. My EMS colleagues, the same thing. But you don't do it like this. And I'm really sorry that he promised you the sun and the moon, and people actually thought it would happen by July 1st. Marianne, do you think the city will still try to phase out HIP, HMO, and circumvent our current premium benchmark? That is my belief. At some point will happen, absolutely. However, it is also my belief that as long as HIP stays alive, even if the city chooses not to keep funding it, the law still reads that the city will provide healthcare up to the HIP HMO. And as long as there's a HIP HMO in the city of New York, then the city should still have to pay up to that point. So that's my point. Yes, 3 copays. Yes, Matthew, trust me, I'm telling you, I'm totally familiar with that. 1 for the ultrasound, 1 for the facility, and 1 for the radiologist. I feel your pain. Literally. There's a document circulating about multiple copays. Kathleen, if this is the one that you're talking about, We went over that. If you weren't here, if it's something else, please send it to me because that's the only copay document that I'm familiar about. If it's something about Medicare retirees that's not related to this, let me know what you're talking about as well. I paid 2 costs in 1 visit. We're still fighting this, Long Beach. This is clearly not going anywhere. How can we each help to prove that OLR is shamelessly selling our retiree healthcare info? Where did that go? While protecting the active info. You know, remind me about that next week when I see you on Tuesday. 1096 strong. Yes, Long Beach. Absolutely. Thank you for fighting. I'm sending my donation tonight. Sorry, I lost the ball with donations due to a shattered kneecap in June. Dawn, get better. I hope you do well. And thank you for supporting the organization. I appreciate it. 24 hours doesn't seem adequate to review any healthcare contract. No, it does not. Because people will have questions. Look, we have questions. Even the health policy people expert health policy people have questions even about the 2 documents that we showed them. And they said, this isn't enough to make a decision, good or bad. We need more information. So these are experts. They're not what's looking at this right now. So yes, I agree with you. I will send that to you and the phone number for the New York State open meeting phone number. Thank you. I don't get why the upcoming Monday RTC meeting is virtual and exclusive for their executives with no guests allowed to access the link. I don't know. I mean, we can ask. Thank you for all you do. I hope you get some rest over the long weekend. I will actually be coming to you on Monday because we have an event on Tuesday. Rheumatologist saw my venous insufficiency, $15. Referred ambulatory vascular, $15. Dermatologist treated psoriatic, $15. Follow up with a primary, $15. Next up, cardiologist, $15. Not done here. And CGP, let me tell you something. I'm gonna try to do an interview with one of our retirees. She's up to $3,500 in copays. This is what the MLC did to Medicare eligible retirees. $3,500 in copays, and because her pension is like a $26,000 pension, and her husband doesn't have a pension, they just have Social Security, they can't afford to pay this, and they can't afford to pay this. So when we say that they don't see you, they don't see what the struggle is, and they're making decisions for you, and labor relations is just encouraging them to do that for just another feather in their cap, and then you have obnoxious people like Lorraine come on here and talk her crap. This is what bothers me, is that this is a vulnerable population, over 65, serve the city, were made a promise, who have small pensions, who retired decades ago, who were sacked with these costs to finance raise contracts for younger active workers that we don't benefit from. They should be doing this on their own backs, not ours. And no one should be stealing your health benefits because that's anti-union. If unions are shown to allow or encourage diminishing benefits for retired unionists, they're going to cease to exist. And it's not going to be an effort coming out of Washington. People will just refuse to start paying union dues because they're seeing, why should I support you when I'm retired? You're going to kill me. What's the point? This is why we keep saying the power of what we are doing is speaking out against anti-union labor actions. New York State AFL-CIO should not be lobbying against your bills. New York State AFL-CIO should not be interfering in legislation to protect retirees. We're not in their union. This is a no-no. The UFT, DC 37, CWA, these unions, with the New York State AFL-CIO, I did 2 videos on this, literally lobbied against our city and state bills, against a retiree, former union members, retired unionists, lobbied against legislation to protect Medicare health benefits for Medicare-eligible current retirees. That's not union. Sorry. What are the other components Judge Frank will be ruling out that was sent back to him on the appeal court because the appeals court only ruled on promissory estoppel and not the other components. Dan, I've been on this for 2.5 hours. There is no way in hell I'm going to remember all of those 12 other causes of action. If you go up onto the Supreme Court, New York State Court Electronic Filing System, NYSCEF, you can look up Benkowski case, look up the brief, and all 12 of those are there. That's a whole nother video all on its own. MLC is negotiating. Also, meeting notes must be uploaded for the public 2 weeks after the meeting took place. If they don't do it, they could be served with an Article 1 appeal. I would say that would have to be the city, and we would have to probably ask the city to do that. And if the city refused, then do that. But I don't think we can serve that on the MLC because they're not open. I don't think they don't qualify under open records. The city does. Laureen, I was late to the update. Do you think that if they get rid of GHI for active workers, we'll lose our gap? No, it's totally separate. And Michael Mulgrew, if you're UFT, wrote a letter to a retiree that I showed earlier, exactly that. Let's see. Copays are an issue at Montefiore as well. They charged hospital fees at their clinics. And if you need blood work, it's a separate hospital charge as well. HIP has been using Quest rather than labs at Monty because of this. So, Jacqueline, HIP has been using Quest rather. So are you saying that HIP is making you go outside rather than inside for their test so they could charge you more? And also, someone had said to me the other day that there's a New York State law that they can't charge you a hospital charge, a facility charge, unless they tell you in advance that that visit is subject to a facility charge. So you may want to look into that as well. Do you know why the MLC won't allow a public to attend? Because it's a private umbrella union organization. It's not open to the public. It is not a public organization. Yes, Article 78 is a lawsuit. I was wondering what you were talking about, but I wasn't going to say anything. Thank you. I'm totally in awe of your knowledge. Oh, thank you, Kathy. Thank you for your time and patience with us. There's still a shortage of leaders. You're a top of the line. Thank you, CJP. Ageism everywhere is sad that either they don't see us or they don't want to see us. I agree with you, my dear. You go outside so they cannot. You go outside so they cannot have copays. You're killing me. All right, Renee. Marianne, oh, Marianne, please, 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 please run for office to protect us all. You're outstanding, and I'm kind of admire you. Well, I appreciate you guys listening and for sticking around for all of this time. I know we started at 5, and this is a lot to digest, but I wanted to make sure we answered all your questions as usual. Since that first part of the hour, I wanted to just go through those documents. Please let your colleagues know that that they really don't have the information. Demand the contract. That's really the most important thing that they could do. And I want to repeat that again because I want to look at my notes real quick. We need to demand to see the contract. We need to know the details. Otherwise, how can the unions being asked to vote on the plan and the controller who will review the agreement to make decisions about what is best for city workers and their families? And you can't. We don't know who's in the network. We don't know what the prior authorizations are. We don't know any of this. And this is important and critical to make a decision for both the downstate 13 and the non-downstate 13. This really has to be done. You should have. I do have a labor degree. I have a graduate degree I have a degree from SUNY Old Westbury in politics, economics, and law, and I've not used it. I mean, I've used it here with you guys, but it's been a while. I really should bring you my Canadian passport. I have my Italian passport. Thanks so much for your awesomeness. Yes, CJP. I should really renew my Canadian passport. I have to renew soon. I think both my American passport and my Italian passport both expire. Thank you for everything you do. You are welcome. Don't the members need to vote on the contract? Well, no. The only ones that vote on it is the MLC. And I don't like that either, because this is an issue. It is a mandatory subject to bargaining, and every member should know what's in this contract before they sign, before their leaders sign it. Mail campaign to Brad. I like that. Yes, I like that. We did that once before. Go ahead. Especially since he hasn't answered me. Is there any hope for us? Barbara, seriously? I have been talking for the last 2.5 hours to the point where my throat is sore. There's always hope. There's always hope. And if there's not, you fight like hell to remove the people that are sitting in office not helping you, to vote in the ones that do. Medical's no good in Canada. All right, guys, I'm going to call it a night. I'm going to go make myself dinner. You guys have a great weekend. I am going to see you on Tuesday, the day after Labor Day. You guys are great laborists and fighting for this for the last 4 years. I appreciate everything that you guys have done in supporting us and continue to do. We are going to see you. Please, 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 please come out. Please come out. Again, please, please, please come out. I want a big showing on the stairs of City Hall. We reserve the stairs. Thank you, Councilman Marte, to have this rally there. And we will be on the stairs. The last time we were on the stairs was January 9th of 2023, when we had that hearing trying to block the mayor from forcing us onto changing the code, changing changing 12-126 and forcing intro 874 to the floor. So we're going to do this rally, ask the mayor, now you're truly Medicare eligible. You truly are one of us. Come on down. Pass this bill, get the speaker to bring it to the floor and pass it. So we will be there on Tuesday. Get there at about 10:15. We will line up on the stairs by 11. It's got to get through security, so don't bring anything you're not supposed to have. We will pass out some signs. We're not going to have a lot. We have some balloons for the mayor, and it should just be a really great day, because I haven't seen all of you, and we haven't seen each other in a really long time. Come out. And then on Saturday the 6th, yes, I know I screwed up yesterday's newsletter and said June 6th. It's September 6th at Manhattan, West 48th, between 5th and 6th. Come and march with us. Bring your friends, bring your family. Come on out. No, I do not know if Mayor Adams will show up, but we're hoping that he might come out. We hope that he will. Maybe have a change of mind. Maybe he'll agree. Who knows? But we are calling a press conference and a rally, and I will see you on Tuesday morning. Have a great weekend, guys. I appreciate you listening. I appreciate your questions, and we are going to start our advocacy on getting the unions to start to listen, that they have to ask more questions and must demand to see the contract. Have a great weekend, everyone. Relax, and we'll have a really good time. I will see you all next week. We will do the rally and then the parade on Saturday. Kickoff, the parade starts at 10, but we don't march until about 1:45. So if you want to get there a little late or come and hang out, feel free to bring your little collapsible stool that we gave you. And some snacks. Check the weather to make sure that you're properly dressed, and come and hang out with us. Wear comfortable shoes, because remember, we're going all the way down to Central Park on 5th Avenue, and we are with the same union again, the Masters, Mates, and Pilots. Wear your t-shirts, wear your blue sashes. I'm looking forward to seeing you guys. Have a great weekend, and I will see you Tuesday. Ciao.
Don't speak what you don't understand.